In this video, we're going to learn the omental bursa or lesser sac. Lesser sac. You know the lesser omentum. It's a fold of peritoneum which is attached to the lesser curvature stomach. We have the great omentum here. Then the last video we have seen that the peritoneal cavity has got two large spaces like greater sac and lesser sac. Okay, and what is this lesser sac? Okay, you can see the reflection of peritoneum. We have already learned this one. Okay, see from the liver to the stomach we have the lesser omentum is here, to the lesser curvature stomach. From the greater curvature we have the greater omentum. So there is a space behind the structure, this area is the lesser sac. Let us see the boundaries. It has got an anterior wall, posterior wall, superior and inferior. Anterior boundary, you can see the liver. So visceral surface of liver. Okay, on the visceral surface of liver there is a part that is known as the caudate lobe of liver. Anteriorly, you can see anteriorly what are the boundaries. The first we have on the liver is a part called caudate lobe of liver. Caudate lobe of liver is here. Then below we have the lesser omentum. Then again, which part of the stomach is there? This is the posto-inferior surface of the stomach. Posto-inferior surface of the stomach. Then it is running downwards. Anterior two layers of greater omentum. Anterior two layers of greater omentum. So these are the anterior wall of lesser sac. First, let us write here caudate lobe of liver. Second, you can see the lesser omentum. Lesser omentum. And what is the third one? Third one is the postero-inferior surface of stomach. And the fourth one is anterior two layers of greater omentum. Okay, that is the anterior layer of anterior wall of lesser sac. Now let us see the posterior wall of the lesser omentum. Posterior wall. You have the posterior wall. Very easy. Let us see. Start from here. The first is the posterior two layers of greater omentum. Then comes the transverse colon. Then comes the transverse mesocolon. Then we have the pancreas, retroperitoneal organ. Then we have the left kidney towards the left side, and it's a space on the left side, lesser side, right? So we have the left kidney, left suprarenal gland. After that, the reflection of the peritoneum over the on the undersurface of the diaphragm. Okay, that whole forms the posterior layer. Let us write. So here posterior to first one is the posterior two layers of greater omentum. Then we have the transverse colon with transverse mesocolon. Okay, then we have the upper part of left kidney with left suprarenal gland. Then we have the pancreas, then the reflection of peritoneum on the undersurface of the diaphragm. Now what about the superior and inferior? Okay, superiorly what structure you can see? Okay, this is the superior part. Superiorly it is bounded by the reflection of peritoneum on the diaphragm, and inferiorly it is closed by the greater omentum. So we have a superior boundary wall and inferior wall. Inferiorly we have the greater omentum. Inferiorly the reflection of peritoneum on the diaphragm. Okay, that is the boundaries of lesser sac. Then it has got a on the right side. You can see what is there on the right side. Right side we have the right free margin of lesser omentum. Lesser omentum. Then you can see on the left side what structure is there. Left side is we have the greater omentum. Then we have the gastrosplenic ligament and lienorenal ligament. We have the stomach. From the stomach to the liver, spleen, we have the gastrosplenic ligament, and from the spleen to the kidney we have lienorenal ligament. So these ligaments on the left side. So on the left side it is bounded by, or it is closed by, we have the greater omentum, gastrosplenic and lienorenal ligament. Now, this greater sac and lesser sac are connected by means or communicated through a foramen that is known as the epiploic foramen. Epiploic foramen, normally asked for examination. Epiploic foramen. It's also known as the foramen of Winslow. Foramen of Winslow. What is epiploic foramen? That means greater sac and lesser sac communicated through the epiploic foramen. Epiploic foramen. So where you can see epiploic foramen. Epiploic foramen is present behind the right free margin of lesser omentum. Right free margin of lesser. See, I'm drawing here. Let's draw a rough diagram. So here we have the liver. Here we have the stomach, like this, and you can see here we have the lesser omentum. Okay, and the space here, this area is known as epiploic foramen. Okay, see, epiploic foramen is communicated. Here we have the greater sac, and the area behind the stomach and the liver is the lesser sac. Okay, so this cavity is the lesser omentum. So then normally it has got the boundaries anteriorly. Actually, you can see what structure we have. The right free margin, anteriorly it is bounded by right free margin of lesser omentum. What structure is there? BPI. We have the bile duct, portal vein and hepatic artery. Anteriorly it is bound by bile duct, portal vein and hepatic artery. Okay, and posteriorly we have two structures. Just behind we have inferior. Posteriorly, what structure is there? Posteriorly we have the IVC, inferior vena cava, and the right suprarenal gland. Right suprarenal gland is present behind. Then above, what is there above this area? Okay, above we have, superiorly we have caudate lobe of liver. We have the caudate lobe of liver, and inferiorly this is the first part of duodenum. This is a duodenum, right? First part of duodenum. Okay, so these are the boundaries of epiploic foramen. Okay, what is the importance of this epiploic foramen? Okay, that is, there is a chance of internal herniation. Internal hernia can occur through the epiploic foramen. Then what is this internal herniation? We have the duodenum. Here comes a jejunum and ileum. So here is the duodenum, and here we have the coils of intestine. Small intestine coils of. Sometimes the small coils of small intestine passes through this epiploic foramen, enters into the lesser sac. That is the internal herniation. Okay, so once there is internal herniation, there is a chance of strangulated hernia. Strangulation can occur. Strangulated hernia. So this strangulated hernia, okay, how can a surgeon approaches this lesser sac? Okay, if there is strangulated hernia occur, so this herniated loop has to be returned back to the abdominal cavity, to the greater sac. Okay, how can it be achieved? So normally he make an incision along the lesser curvature of stomach. This is the omentum. Okay, the anterior two layer and posterior two layer. Okay, he make an incision along the lesser curvature, so somewhere here, okay, on the lesser curvature. So what happens if we cut this first and second layer? We reaches the lesser sac. Okay, so incision is given along the lesser curvature, so the extra fluid, get collected. If there is herniation occurs through this, if there is lesser curvature, so the fluid get collected. So intestinal loop, this is intestinal loop. The fluid get collected in the intestinal loop, like this. Okay, so once to reduce this hernia, okay, so it has to taken back to the normal cavity, greater sac. Okay, for that the fluid, first the fluid which is collected in here, it has to be taken out. For that, incision is given along the lesser curvature, greater curvature stomach. First and second layer of the peritoneum is to be cut. The fluid from the intestine is removed. Then after that, the hernia loop is taken back through the epiploic foramen. Epiploic foramen. Remember this one. Hope you understand. Hope you understood the reflections and the peritoneal ligaments, some of the peritoneal ligaments in the abdominal cavity. If you like the video, please like, subscribe and share it with your friends. Thank you.